Sandra Bullock's longtime partner Brian Randall passes away from ALS. Learn more about the condition's signs, causes, and treatments. Brian Randall, the longtime boyfriend of actress Sandra Bullock, went yesterday at the age of 57 following a 3-year struggle with ALS, according to a statement his family sent to People magazine in the United States. It also added that Brian lost the battle with the ailment gently on August 5. Brian made the decision early on to keep his ALS journey private, and those of us who cared for him tried our best to comply with his wishes, the statement stated. We have the utmost gratitude for the amazing nurses who became our roommates and the unwavering doctors who walked with us through this illness, frequently sacrificing their own families to be with ours. His family requested seclusion, according to the statement's conclusion, to grieve and to come to terms with the impossibility of saying goodbye to Brian. According to Dr. Pavan Pai, a specialist in interventional neurology at Wockhardt Hospitals on Mirror Road, Lou Gehrig's disease, or amyotrophic lateral sclerosis, is a degenerative neurological condition that damages nerve cells in the brain and spinal cord. The primary outcome, according to him, is the degradation of motor neurons, which are in charge of regulating voluntary muscular movements. The specialist stated that the precise cause of ALS is still mostly unknown. If there is a family history of the illness, it may be inherited in some circumstances. Specific gene mutations are associated with 5–10% of instances of ALS. There are some rare cases that don't seem to have a family history. Dr. Pai continued, oxidative stress, inflammation, and anomalies in protein handling within nerve cells are some potential contributing factors. While ALS symptoms might vary, they often involve twitching and weakening of the muscles as well as trouble speaking, swallowing, and breathing. People may face more difficulties with their motor functions as the disease advances, which could ultimately result in paralysis and severe disability, Dr. Pai stated. According to Dr. K. Sai Satish, a consultant epileptologist and neurologist at Yashoda Hospitals in Secunderabad, the symptoms vary depending on the muscle group that is impacted. For instance, if the muscles of the throat are impacted, symptoms including trouble swallowing and vocal changes may manifest. Similarly, ALS patients experience breathing difficulties, arm and leg muscular weakness, and breathing difficulties. It is significant to remember that ALS has no effect on a person's sensibility, IQ, or consciousness, with the exception of weakness. Although ALS doesn't necessarily result in death, it can have serious side effects.